Hi everyone, my name is Elsie Amoko and I am the founder and CEO of Mommy Monitor, a maternal health care platform that allows us to be able to customize the maternal health care experience. Now currently in the United States, it's considered one of the most dangerous places in the world to give birth. And although we don't have the same experience in Canada right now, there are still many trends and patterns that are consistent that all lead to the same outcomes. One of these trends includes the fact that women over the age of 35 are consistently considered geriatric age and are 94% more likely to have at least one complication during pregnancy. And we see this even more so within the Black community, where a Black woman can be up to 4 times more likely to experience maternal mortality in comparison to a white woman. Now, where the problem stems from is the fact that maternal health care has been generalized for way too long, when it should be personalized. Women have millions of questions during pregnancy, and because they don't have the right people they can ask those questions to at times, and because they don't know where to access the right services, if the services are even available for them to access, and all of this then contributes to them not having the right social support around them, all leading to them having detrimental pregnancy outcomes. Now the solution is simple. The solution is Mommy Monitor. At Mommy Monitor, we provide a maternal health care platform that provides pre- and postnatal on-demand support to moms, in addition to providing behavioral analysis to predetermine pregnancy complications before they even occur. Now, although we haven't launched yet, we will be launching in the next 2 to 3 months. However, we'll be launching in 2 different phases. Our first phase is what we're going to focus on initially, which is on-demand support. We have a marketplace that we're developing that will be available for moms to be able to filter out the process, identify their own preferences, and be able to choose the right doula or midwife to work with throughout their pregnancy. And this is not your primary form of support. We still want you to work with your provider, but we're that special add-on that will give you the extra needed support that you need to have better outcomes. The second phase of this, in addition to that, we also have a CRM system that's built in for the healthcare professionals and the midwives to help them to organize their patient files. The second phase in particular is focused more so on how we can use behavioral analysis to predict pregnancy complications before they even occur. We've now developed a team out of Mount Sinai Hospital in Toronto with the director of maternal fetal medicine, Dr. Cynthia Maxwell, and other scientists, and we're all working together to develop the evidence needed to support this aspect of our work. Now, we do all of this with 3 basic packages. The first package is more of a pay-per-use package where we tell moms, hey, this is really flexible. Come to us, use our services whenever you need them, at any point of the day, at any time, whether it's in person, via telephone, or via video chat, whatever works for you. But then, if you find someone that you really like, a great doula, a great midwife, a great nurse, then hey, now you have the opportunity to sign up for 2 of our other packages. And then you have at least 10 visits or 20 visits that are set up and scheduled between you 2 so that you have that consistent support that you need. And the market that we're working with are the women that I mentioned earlier on, which is women over the age of 35 who are considered geriatric, again, pregnancies, but there are more professional women, and there are women who are already purchasing add-ons at the time, already for their pregnancies. Our go-to-market strategy is focused on aggressive social media, and then in addition to that, we're also working on focusing on referrals through partnerships with hospitals, private clinics, community health centers, and other organizations. Currently, Mommy Monitor, what makes us unique, apart from the fact that we want to predict pregnancy complications before they even happen, is the fact that we have this on-demand support and we're focused on women and we're focused on doulas and midwives in particular, as opposed to just education or doctors or hospitals like other pregnancy apps. Although we haven't launched it, like I mentioned earlier on, and our traction is not revenue-based, we do have a lot of other traction. We have, just this year alone, we've had over 200,000 hits on our website, and all of this is without any marketing whatsoever. We haven't marketed at all, we haven't even begun to. But we have a conference that we do annually, we have a subscription list of healthcare professionals ready and willing to work with us, and moms who are already willing and ready to work with us as well. We also have been a part of a lot of great accelerators like 1863 Ventures, in the Next 36, and we've also had the opportunity to win a lot of awards from WeWork and the Center of Social Innovation in Startup Canada. Our team includes a group of amazing people who have backgrounds in biomedical science, biomedical engineering, computer science, and health policy, and today our ask is between $250,000 to $350,000 to focus on research that I mentioned earlier on, in addition to building out the predictive component of the app. Now, as I close, The last thing that I want to say to you guys is that Mommy Monitor is in a unique space where we have the opportunity to revolutionize the way maternal health care is provided globally. So our question to you is, who here is ready to join us? If you have any other questions, you can reach us on our website and social media. Thank you.
Thank you so much, Elsie.
Thank you.
Let's start with the questions from our judges. Should we start with Allison on the other side?
Thank you, Elsie. That was a wonderful presentation.
Thank you.
That's really interesting going into sorry, I'm just getting my thoughts together and I've had a lot of coffee today.
Yeah.
I have a question around the revenue model. And so the basic plan, pay per use, love it. If someone finds a doula or a midwife that they like, what is stopping them from going directly to that doula, or like what's keeping them on that
Separately
platform?
from us, right?
Yeah,
I think that for us, the way that we're going to retain our doulas and midwives and other people who are working with us, if it's a midwife, likely they'll be freelance, most likely if they are working with us. If it's a doula, the leads that we give them, in addition to the CRM system, which neither healthcare or professionals have right now, are the other things that will keep them with us as well. And also, to be honest, if we lose a few, it doesn't kill us because women get pregnant all the time consistently. So we'll always have another customer come back, and we'll always have somebody else come back. And what's even more special is we are actually training doulas in-house. So we're training our own. We've gotten government funding, so we're able to train some women for free even to become doulas, just so that we can ensure that we have a diverse population as well of doulas who are supporting moms.
That makes a lot of sense. And just a quick follow-up.
Yeah.
Are you making, or are the doulas or midwives paying for the CRM service?
They just pay a sign-up fee for us, but they're not paying anything else. They'll receive their payment through whatever patients that they work with throughout the time. So just if it's similar to Uber, if they see 30 patients, then they are paid for that. Yeah.
Okay, great. Thank you.
Thank you.
Great presentation.
Thank you.
Would love to hear a little bit more around customer acquisition.
Sure.
And particularly, in the beginning, you spoke about kind of this area has been generalized but hasn't been personalized. So are you kind of focusing on particular communities of the kind of post-35 kind of pregnant woman? And then as well, it seems like there's a community aspect here, but
Yeah.
it was kind of unclear of how that actually
Connects to this?
exactly. So we'd love to hear kind of both
Yeah.
of those points in that.
For sure, I'll speak on the community aspect first. So my background is in research. I've done it for a little over 8 years. I'm still a grad student. I've been doing it since I was in undergrad, so it's been a while. But a large part of the work we do and what we've been funded for through our government is being able to do free birth justice workshops in the community, to tell parents about their rights, to be able to do a conference that we hold annually. In the first year we had 200 people. This year we had 400, and we plan to have over 800 next year. And that audience is mainly government officials and all clinicians who are in the birth space. And all of these people are very much invested in the work that we're doing, and they kind of spread the word for us. So that has helped a lot as far as like customer acquisition from that perspective. For parents in particular, we're gonna focus a lot more so, I think on Facebook and Instagram, we're noticing a lot of people are more perceptive to us through that in particular. And we're gonna focus a lot on the educational component, right? And using education to kind of draw moms in, because the biggest thing is moms have a million questions and they don't know who to ask or where to go. So we just want to be that source that they look for. And once they see that source and they get enough information from us, then they're like, oh, they also provide these services. And then they can kind of jump on board from that.
Great, thank you.
No problem.
My question is a little bit double tapping into this customer acquisition
Sure.
piece, which is when you think about the messaging for something like this, no one wants to, when you're pregnant, no one wants to talk about maternal mortality.
No.
And so how do you think about messaging it in a way that is affirmative, that is positive, and then it's more focused around this concept of curiosity and personalization, as opposed to how do we prepare for the worst case scenario?
Yeah, we don't market at all with that like that. When we do begin marketing, it'll be focused mainly on the idea that we want to help you or support you to advocate on your behalf and help you to have the most personalized, patient-centered experience during pregnancy that you could possibly have. And that's all we are going to focus on. Our mandate and our vision is about providing equitable healthcare and ensuring that people have the care that they want when they need it. And that's what we kind of are going to continue to focus on.
And then just a quick follow-up question. What's the data that you need from the user
Yeah.
to be able to give them this really personalized experience? And how much of that can come from an integration with something versus actually user-generated?
Yeah, and that's actually a really great question because my background is in research, I've kind of made it a point to ensure that we're not taking too much data because nobody likes that, and we already know the complications that consist around that, especially with regards to healthcare. So presently, what the app would collect for the first phase is just like information like where you live, basically trimester, age, like information that we just need to know generally. No medical records or any of that information is anything that we'll collect. In the second phase, the doulas or midwives, we call them maternal mentors. They're gonna have the opportunity to then ask permission of the patient whether or not they would take a survey or answer certain questions. We'll use that data in addition to the data from the registration and then other data, like we may have to integrate into their EMR of their physician or whatever that looks like to have as much information that we can use so that then the physician has the opportunity to then be able to identify what complication they could be more susceptible to. And then they would deal with that so that the parent is not stressed and they don't feel uncomfortable.
Thank you so much, Elsie.
Thank you. Thank
There's
you,
no
guys.
time for feedback, unfortunately.